Good morning. We're with Jonathan Woodward again for part 2 of our opioid installments. How are you today, Jonathan?
I'm doing quite well, thank you. How are you?
I'm doing really well. For a Tuesday morning, it's hot and humid out.
Yes.
It's nice to be in here talking about the process that you manage here, Jonathan.
For sure.
So just a few questions. The last episode was very popular, and what came out of that was some interesting questions that people asked, and very, very good questions. So do you mind taking a few minutes today just to look at some of these questions with us, Jonathan?
Oh, for sure.
Excellent. Well, we'll start off with number 1, a good place to start usually. So if I sign up, can I get treatment right away? The second part of this question is, do I have to see a doctor? And how does the process work in general?
Okay. Well, we offer sort of like a walk-in service. You don't have to have an appointment to come in to speak with us. And typically when you come in, you'll see a nurse. That's who's in the clinic right now. So myself or Cheryl, and there's a couple other nurses that work with us. And what we do is there's a bit of paperwork that you'd have to kind of go through. So there's some basic consents for our service that you'd have to read and make sure you're on board with. And we give you some of the information about the service itself. And we go through some of that paperwork with you, and we get you on the phone with the doctor that same day. We usually do our appointments Mondays and Wednesdays. And so we'll do our initial sort of intake. That's what the paperwork is. And it goes kind of over your some of your medical history, any of your substance use history. And we can go over any concerns you have at that time. And we'll sit down and do that. And then we'll get you on the phone with the doctor. And if you're looking for a prescription or something to help curb some of your substance use, that's what those appointments are for. And we do urine sampling as well. So you'd provide a sample with that initial appointment, and so the doctor has an idea of anything that's in your system, because that's important for any prescriptions that are going to happen. We need to know kind of what you're taking, and we just sort of go from there. You come in twice a week for the urine sampling, and you'd speak with the doctor every week as a follow-up.
Okay, so for that initial appointment, how long would that appointment take on average?
There's a fair amount of little paperwork that we have to kind of go through. So that's usually about 20 minutes. And then our part, we just input some of the information. So I'd say, maybe about a half hour that you'd be here for that initial sort of appointment. And it depends on if you have a home phone, cell phone. You can have the doctor call you at home, or you can stay around here and wait for the phone call in our office. And so that can extend your time here at the wellness department. But initially it'd take about a half hour to get through all that initial stuff.
That's not bad at all. So it's reasonable to expect that if a new patient shows up, they can actually get treatment that same day then?
Oh, for sure, yeah. It's if you were to come in on a weekend, like we're here 7 days a week with our dispensing of the medications, so you can get sort of that initial paperwork anytime. We try to keep our appointments for Mondays and Wednesdays because that's when we have our doctor available, who's the addiction specialist in Sudbury. And so if you were to come in on a weekend, we might give you the paperwork to take home and look over, have you come back on the Monday morning to get you set up with our service.
Beautiful. Well, thanks for explaining that. Seems very straightforward. The next question that we've been getting asked a lot is around the stigma with coming in. And basically the question is, I'm concerned that other people might see me coming in for this kind of treatment. Do other people have similar concerns, and how do you manage this, Jonathan?
Yeah, no, absolutely. I have heard that a couple of times, and the nice thing is being at the wellness department here with the doctor and the nurse practitioner that's in here. We have the other nursing services like the primary care physicians. So you can be coming to the wellness department for basically any service. We have the wellness counselors are here, the addictions counselors. We have our traditional medicine practitioner that comes in fairly once a month. She's here and she's available whenever you can call her directly. So you can meet basically anybody of any of these services in this building. So you're coming in the front door. Nobody has any idea why you're coming to this building. We do also have a separate entrance around the back that some people do make use of because they don't like necessarily coming in the front. So we have our own entrance around the back of the building that you can come that is right next to our clinic.
Well, thanks for clarifying that. That makes a lot of sense. So really, people have no idea why you'd be coming in this building.
Oh, exactly. Yeah, you could be coming here for any health service whatsoever. People come, they do the COVID vaccine clinics. You could be coming here for a flu shot. It could be anything.
Well, thanks for clarifying that. Another question that's been fairly common is if the decision is made to proceed with treatment, would the patient have to stop taking other legal drugs such as alcohol, cigarettes, or other prescription medicines?
Well, obviously, what we're trying to do is sort of curb someone's usage, and we really want to kind of hammer down to the reasons that somebody is abusing different substances. So it's not as if you have to immediately stop everything that you're doing to be a part of our service. That's not the point. We're trying to help people curb their substance use, and that's why we connect people with the addictions counselors or the wellness counselors to kind of deal with the underlying issues. And there would be an issue for you can get take-home doses. So if you having your urine samples every week, if you have clear samples for a certain period of time, typically a month to begin with, you can start getting take-home doses, so you're not coming to the clinic every day to get your dose, or to the pharmacy every day. In order for that, you have to be clear of any substance use, but you can still be a part of this program while using substances. Like I said, we're trying to basically curb someone's substance use, and it's more of it's a harm reduction approach. So we're just looking to meet people where they are and do whatever we can to help them.
So what would happen if I went out on a Friday night and had 6 beers, for example? Would that cause me to be expelled from the program, or would I still be able to continue if I slipped up like that?
Oh no, there'd be no issue, and we offer other services with like alcohol cravings and stimulants and that sort of thing. So there's people come in here for different parts of the program, but your drug usage and your alcohol use isn't going to like suddenly expel you from the program for any reason. We will kind of keep track of some of the substances that you're using, like with those urine sampling that we do every week, because we want to make sure that you're not in danger of overdosing. The doctor keeps an eye on what your medication is and anything that you've been using, and they'll counsel you on the dangers with everything that you might be using, because obviously excessive use of these substances while on some of these other medications, you are at risk of overdose. So that's something that we try to provide all the information, but like I said, we try to meet everyone kind of where they are.
Thank you. Well, it sounds like you take a very comprehensive approach. That was a nice, clear answer. So basically, if someone is using substances, you'll help them wean off, and it's not like cold turkey; they just have to stop.
No, exactly. Like that's the whole point, is to these medications that we have are sort of a substitute, and they're to control the cravings, control the withdrawal symptoms. But you start at a low, safe dose. So, and that's typically too low for most people to like fully substitute with what they're using. So the doctor will work their way up to get a therapeutic dose where someone can, is not necessarily needing the illicit drugs to get that same, relief from their withdrawal symptoms.
So actually, you kind of led into the next and final question, and that is, do you only provide treatment for opiates, or is there other types of services that you provide?
Yeah, no, there's definitely other services. We have medication available for anti-craving with alcohol and stimulants like cocaine and amphetamines. So it's you're not just coming in here for the opiate use disorders. We have multiple medications and other therapies available for depending on what your substance use or abuse is. So yeah, there's definitely other options.
Well, thank you very much for taking the time today, Jonathan. This is very enlightening, and we look forward to part 3 of the installments in a couple of weeks. But for now, I think this gives people a lot to take a look at.
Excellent. Well, thank you very much, Sean.
Thank you.